Hey everyone, and welcome to the Med Legal Green Room. I am Sam Frentzas, co-founder of the Driving Force Company, and today I'm absolutely excited to have Dr. Pierre here, known as Coach JPMD, as an internal medicine physician, healthcare entrepreneur, and technology innovator with more than 20 years of experience serving patients in Florida. And Dr. Pierre has successfully built and managed a Medicare-focused practice overseeing more than 15 million in payer premiums while leveraging technology, operational excellence to improve patient care and practice performance. A graduate of Howard University and Albert Einstein College of Medicine, Dr. Pierre is passionate about mentoring physicians, advancing healthcare innovation, and helping medical professionals thrive in an evolving healthcare landscape. Dr. Pierre, welcome to the Med Legal Podcast.
Thank you. Thank you for having me. It's great to be here and to be able to impart some knowledge to your group and to your audience. You've been doing some innovative things on your side as well, so it's great to be here.
Yeah, this is pretty exciting when we had our little pre-interview chat and stuff, and really kind of getting your blueprint. What you call the business of medicine, and decreasing stress while generating wealth for doctors. So I thought that was, I mean, look, that really struck with me. And your blueprint, and I'm really going to kind of get out of the way and kind of let you go over your blueprint without any interruptions here, because look, I found it extremely valuable, and I know all our members, all our followers, all our listeners will gain, some really gold nuggets of information from you. So, Dr. Pierre, let's go and talk about your blueprint.
Thank you again. The blueprint is something that I came up with a couple of years ago. I started a podcast initially called the Practice Impossible podcast, where I was helping physicians understand the business of medicine and really imparting the knowledge that I've gained over the past couple of years, couple of decades, I guess, in the managed care space. But realized also that there are a group of physicians that are fighting to get out of the system or fighting not to be in the system of corporate medicine and system of really being employed physicians. And physicians, some of them want to be independent. And I think you know that as well in
Oh,
the
yeah.
imaging world, where physicians who are independent tend to make a little bit more money and tend to
A
a
little bit.
little bit. And they also tend to be less stressed. And one of the things that kind of drove me to this second passion was the rate of suicide in our general population of physicians. We unfortunately have the statistic where 1.8 times more than the general population, physicians commit suicide, and that's a number that is crazy when I look at it. And so we try to figure out why that is, and I think that the data is still not there as to what exactly is happening. But at least from my experience and from what I've seen in my immediate surrounding, a lot of it has to do with stress, and either stress of the practice, stress at home, stress in their physical, spiritual, mental life, but also understanding or not understanding the business of medicine. And so when you have physicians coming out of residency with $250,000, $300,000 debt, and they're given a job to do, and they need to perform at that job, and they have no idea when they're going to pay off their student loans, and they haven't been really able to spend any money because they weren't making any money in residency.
Yeah.
So they come out saying, you know what, it's been so long, it's been 11 years of training, 15 years of training, I'm going to buy that expensive car that I always wanted because I'm making enough money. Or I'm going to buy that house in the nice neighborhood because that's where all my attendings are living. So I need to, be there. Or my kids need to go to a good school because all the other doctors' kids are going to good schools. And so the lifestyle creep comes up, and you start to spend more than you're making, and that drives even more stress. So how do we mitigate that? What is the blueprint for that? And so that's kind of where I came up with the physician's blueprint, and where I really focus on managing you as a physician first, helping physicians get out of debt, because that is a big driver of stress. The borrower is a slave to the lender. If we read the Bible, and we know that we need to get out of debt as quickly as possible, because we know that if we get out of debt within 3 to 5 years of post residency, the ability for you to generate wealth with the money that you were paying towards that 8%, 9% debt is like a savings. It's a 9% savings rate.
Yeah.
So that's kind of where we focus. And I know I've been spoken a lot. I wasn't sure what direction you wanted me to take for or go with your audience, but that's kind of my focus. Decrease stress and generate wealth. How do we generate wealth, get out of debt, and then start to accumulate the wealth that we all deserve?
Yeah, they don't really teach the business and financing in medical school. I do remember speaking to a group of doctors, um, and I gave my presentation, and then they asked me to fill in real quick, somebody that was there. These were all graduates. So my background's in finance. I'm like, okay, let me talk to something that I know. And they're all excited, and every hand went up in the air because they all want to own a practice and they all, want to help people and live this, doctor lifestyle. And then I punched him in the mouth with what it takes
Yeah.
to own a business, operate a business, payroll, insurance, top line revenue, bottom line revenue. And by the time I was done, I thought they were going to stone me right on stage and throw popcorn and bottles and everything else at me because at the end of the day, they don't really teach this in
No.
medical school. They teach you to be a doctor. They don't teach you to be a business owner.
Yeah, and it's not necessarily the fault of the physician. But I do say their onus is on the medical schools and the residency training programs to maybe bring in resources to the schools to be able to get the knowledge out there. When you look at academic universities, where my alma mater, these are huge institutions with huge budgets, but these budgets are mainly through research budgets, right? There's a lot of research dollars coming into the universities, and these professors and these researchers have to um, research. They have to, get the grants to be able to maintain their departments. And so there's not a lot of physicians in the academic institutions that understand what you just said about bottom line, top line, profit and loss statements, setting up LLCs, because they don't have to do that.
Yeah.
So the residents come out really not knowing it because there's no one there to teach it to them. And so I had the fortunate, I had a professor who taught us every week. He would actually set up a lunch hour for us. And he had owned a private practice prior, and then he came to the university. And he said, anyone who wants to come and ask me questions about private practice world, come on. And I was one of 5 residents that came out of a group of 80 plus residents.
Oh,
So not a lot of us were even interested in the free knowledge that his professor was giving us. So it's telling for sure.
that was valuable. I mean, you don't get that offer, that opportunity. But you saw what a game changer was for you because somebody was able to teach you and guide you. Because I always say, follow in the footsteps of those that are in front of you that are successful. Don't reinvent the wheel.
That's correct.
Follow what somebody's done before. So if we would say, let's take one thing
Mhm.
that you would advise and tell someone, a doctor, to do today to make a change, a small change even. What's the one thing you would tell them to do today that would make a change in their lives?
I would say, I would ask the question. I'm all about asking questions to kind of delve into the mindset of the physician. Um, what are you committed to? What do you want? Is the one question I would ask. Because if you find out what you're truly committed to, are you committed to, living a great lifestyle? Are you committed to weekends off? Are you committed to your family? Are you committed to researching? Find out what you're committed to because it's what you're committed to is what's going to drive that motivation. It's going to drive everything else. And so if you're committed to paying off your debt as soon as possible, then that should be the sole focus, right? And so if you're able to do that, then everything else follows that. And once you're out of debt, then you can do whatever you want. Then you don't have to work for the big corporations because you don't need to, because you don't have the need that you would have
Yeah.
had if you had the $300,000 debt. So what are you committed to is the question I always ask.
It's a great question to ask yourself, right? Get in front of the mirror and ask that question. That was awesome. That's very insightful too, because now you're really putting yourself on the spot to be truthful with yourself. Now, I'm going to make a little announcement here. So, no one really knows this yet, but I do. So, I'm going to go ahead and spill the beans. So, Dr. Pierre's got a new book that's going to come out soon called The Independent Physician's Blueprint. So there's no link for you to go and buy it now or get your hands on it. But if you click the links below, follow him on Instagram and LinkedIn, the announcement's going to come. You definitely want to be one of the first to get the independent physician's blueprint. It's just you come from such a place of giving. It's utterly fantastic, and I really appreciate you taking the time out today, and speaking to us and to our doctors that are listening and following, and just getting again that one nugget of information that could be a game changer. And I know they're going to be following you and get your latest book, The Independent Physician's Blueprint, and really change their lives. The younger, the better, but it's
Yes,
never too late.
that
It's
is correct.
never too late.
Thank you so
So,
much for that. I'm really passionate about helping physicians, and as you know, as we spoke, your audience, I think, has that mindset, and so if
yeah,
we can disseminate that mindset amongst all the other physicians out there, trying to figure out how to practice medicine, and that's the ultimate goal.
I appreciate that. So, Dr. Pierre, thank you for taking the time out today. Everybody, click the link below. Follow Dr. Pierre. Get that new book when it comes out. I got little snippets of it, but I won't spill the beans on it. It is absolutely fantastic. And if you're a doctor, you're a business owner, this is a game changer for you. So, click the link, follow Dr. Pierre, and grab the Independent Physician's Blueprint when it comes out. Dr. Pierre, thank you.
Thank you.